Hello, I'm Julian Webber. I'm one of the co-developers of WaveOne Gold. I'm also an endodontist with a busy practice in London's West End. Several years ago, when we started working on the WaveOne instruments, the team came up with several core principles which drove our design processes. One of the key ideas we wanted to incorporate was that a single instrument could do the shaping job in many cases. To do this, we needed to design an instrument that would closely follow and shape the canal pathway, and do it in a way that didn't lead to over-instrumentation. A small number of tip diameters matched with commonly recognized apical diameters were a must. Today, the WaveOne Gold instruments have sizes 20, 25, 35 and 45 at the tip. In my hands, the WaveOne Gold Primary, which has a 25 tip size, can shape up to 80% of the cases I face every day, and I see some really challenging cases come through my office. WaveOne Gold instruments feature decreasing or regressive variable tapers. The Primary starts as an 07 taper at the tip. At the coronal end, where tooth structure is precious for restorative reasons, the instruments slow their rate of taper. WaveOne Gold Primary has an 03 taper at D16. As you know, canal preparations that have sufficient taper and good resistance form are ideal for both irrigant exchange and removal of debris. This promotes both 3D disinfection and filling of the root canal system. WaveOne Gold instruments are so efficient you never need to force them down the canal. They just seem to work at their own pace. I suggest a 2 or 3 pass sequence. This should be sufficient to fully shape the canal to length. Of course, you must always remove the file regularly to clear out all the debris being generated. Each time you remove the file, irrigate, recapitulate with a number 10 hand file to length, and then re-irrigate again before continuing with shaping to working length. In addition, each time I remove the file from the canal, I inspect it for any signs of wear and distortion. WaveOne Gold are single patient use instruments which cannot be autoclaved. This should be considered as the gold standard for infection control. Just as importantly, however, is the fact that one instrument is doing the job of 3 or more traditional rotary instruments. Logic dictates that overuse increases the possibility of file breakage regardless of any enhancements in design and metallurgy. I hope you will agree that incorporating WaveOne Gold instruments into your endodontic treatment routine will be a tremendous addition to your practice.